I think the first challenge is understanding that capacity building is more than skills development, that it really is about human resources and workforce development. So it is about numbers of positions, creating the jobs, and understanding that to get anything done in safely managed sanitation takes people, takes individuals.
When you talk about the capacity development of the professionals outside the government system, the civil society organizations, community leaders, the women engaged in the sector, they have less opportunities or no opportunities for them for the capacity development. So that needs to be taken care.
I think the other important point to recognize is that so much depends on poorly paid or unpaid individuals for the success. We depend so much on volunteers and on the informal sector to deliver much of the sanitation and hygiene.
Retention issues or problems, because often at times you can have some staff in one region and you have contributed in their skills development, and often at times those staff either they are transferred or posted to another different workplace. Most of the time, some people weigh what's their remuneration, what is their pay they will receive at the end of the day, because that is also critical to their livelihood, to them supporting their families.
When we do the assessment and also when we do the planning, so it is very important that we include all the sector stakeholders, including the communities, to be a part of the capacity development plan, so they can also sharpen their knowledge, remain up to date, and contribute effectively and efficiently to the sector.
Without adequate workforce, we cannot be able to drive the agenda of sanitation. So workforce at all levels, at policy level, at implementation level, at monitoring level. Workforce of trained personnel and also at community level.
I do hope that countries' representatives can go back and begin to understand within their systems what it takes to create the positions, develop the positions, fill, and move towards a system where there is career development for these individuals, because there is the right remuneration packages and the right working conditions.
How do we normally conduct periodic and HR capacity assessments? How often do we review and update our HR capacity plans? And then we need to invest more in HR and workforce. We also need to invest in our capacity plans, because if we have identified those gaps, how can we be able to ensure we solve or address those actionable steps that we have proposed?